We are spotlighting ADHD, a disorder that many of us have heard about but sometimes misunderstand.
Local 3's Riley Nagel gained some insight to share with us. He has the story.
When we think of ADHD, many people picture a child who won't sit still or won't pay attention, but what we don't see is their internal struggle to control themselves. Local mental health professional Katie Burns says that hyperactivity we see is just the tip of the ADHD iceberg.
The diagnosis of ADHD means that your brain is working harder than the neurotypical brain.
Burns explains the disorder is like having a barrier in the brain, impairing a person's ability to learn, forcing them to work around the hurdle, processing information differently.
So it's already run a marathon in order to do some of what a neurotypical brain might see as an easy task.
ADHD is one of the most common mental disorders in children and is estimated to affect 8 million adults in the U.S. Common struggles include staying focused on a task for extended periods, organizing thoughts, remembering important details, time management, procrastinating, and regulating impulses.
So then you have a higher level of fatigue, higher level of frustration, and other people might look at this as that was easy. What is the problem?
Burns says the added effort to compensate for their challenges often leads to anxiety and depression.
You can learn a lot of helpful strategies to manage your ADHD diagnosis.
Healthy coping mechanisms involve prioritizing sleep, exercising, setting timers, practicing mindfulness, and asking for help. Burns says taking medications like Adderall or Ritalin can be helpful as well.
So if you can find that you can manage yourself outside of the medication, that would be wonderful. But a lot of people don't seek therapy for that.
Though the disorder has its downfalls, there are upsides, like being an adaptive learner, energetic, and spontaneous.
Oftentimes people with ADHD are very creative. They can do a lot of social things that other people can't do because, again, they can shift gears so easily.
If you think ADHD is a part of your story, Burns encourages people to reach out to a psychological examiner and get the help you need. For Local 3 News, I'm Riley Nagel.